I need you to stop what you're doing right now, because what I'm about to share with you in the next few minutes could be one of the most important things you hear all year, especially if you are over the age of 60 and you are currently taking medication for high blood pressure. My name is Dr. Thomas Reed. I am a physician specializing in internal medicine, and I have spent over 25 years working with patients, many of them seniors, managing chronic conditions like hypertension, diabetes, and kidney disease. And in all those years of practice, there is one pattern I keep seeing over and over again that breaks my heart. Patients come to me, good, careful people who take their medication every single day exactly as prescribed. They do everything right. They follow the rules. They trust their doctors. And yet, quietly, silently, without any warning, their kidneys are failing. And when we run the labs and we look at the numbers, the culprit is almost always the same. It's their blood pressure pill. The very medication that was supposed to protect their heart is destroying their kidneys. Now, before I go any further, I want to be very clear about something. I am not telling you to stop taking your medication. Please do not do that without talking to your doctor first. What I am telling you is that you deserve to know what is happening inside your body. You deserve the truth. And that is exactly what I am going to give you today. So stay with me, because by the end of this video, you will understand exactly which medications carry this risk, why this happens, especially after the age of 60, what warning signs to watch for, and what you can do naturally to help protect your kidneys right now. Let's begin. First, let me give you some numbers that I think will surprise you. According to data from the American Heart Association, approximately 70% of adults over the age of 65 in the United States have high blood pressure, what we call hypertension. That is nearly 7 out of every 10 seniors, and the vast majority of them are on medication for it. Now, the most commonly prescribed blood pressure medications in the world today are a class of drugs called ACE inhibitors and ARBs, angiotensin receptor blockers. You may recognize some of their names: Lisinopril, Amlodipine, Losartan, Valsartan, Ramipril. These are some of the most prescribed drugs on the planet. Millions of seniors take one of these pills every single morning with their breakfast without thinking twice about it. And here's the problem. Your kidneys after the age of 60 are not the same as they were at 40. They are more fragile, they are more vulnerable, and they react very differently to these medications than a younger person's kidneys do. The medical community knows this. The research is clear, but somehow this information rarely makes it into the exam room conversation. So let me explain what is actually happening. I want to take a moment to help you understand your kidneys, because most people have never really thought about what these remarkable organs actually do. You have two kidneys. They sit in your lower back, one on each side of your spine, roughly the size of your fist. And every single minute of every single day, they filter about 1 liter of blood. In 24 hours, your kidneys filter approximately 180 liters of blood, catching waste products, excess minerals, and toxins. And they flush them out through your urine. They also regulate your blood pressure. They control your fluid balance. They produce hormones that help make red blood cells. They activate vitamin D. Your kidneys are doing far more work than most people ever realize. Now, here's what happens as we age. Starting around age 40, we begin to lose kidney function at a rate of about 1% per year. This is completely normal. By the time you are 60, your kidneys may already be operating at 70 to 75% of their original capacity. By 70, it could be closer to 60%. This decline is natural. For most healthy people, it is not a problem. You have enough reserve. But, and this is critical, when you add a blood pressure medication into that equation, particularly the medications I mentioned, something dangerous can happen. And most doctors don't tell you about it until the damage is already done. Let me explain the mechanism, and I will keep this simple. ACE inhibitors and ARBs, drugs like Lisinopril and Losartan, work by relaxing your blood vessels. They block a chemical in your body called angiotensin, which is responsible for tightening blood vessels and raising blood pressure. When you block angiotensin, your vessels dilate, your blood pressure drops, and your heart doesn't have to work as hard. That sounds good, and in many cases it is. But here is what also happens. Inside your kidneys, there are tiny filtering units called nephrons. Each kidney has about 1 million of them. Inside each nephron, there is a tiny ball of blood vessels called the glomerulus, and it is under a very specific amount of pressure to filter your blood properly. Your kidneys actually use angiotensin to regulate that internal pressure. They rely on it. It is part of their normal operating system. When you take an ACE inhibitor, or ARB, you are blocking angiotensin throughout your entire body, including inside the kidney. This drops the pressure inside the glomerulus. And if that pressure drops too much, filtration slows down or even stops. In a young, healthy kidney with full function, the organ can compensate. It adjusts, no problem. But in a kidney that is already running at 65 or 70% capacity, the way most kidneys are after the age of 60, it cannot compensate as well. The pressure drops, the filtration rate falls, and over time, month after month, year after year, the nephrons begin to scar. Once a nephron scars, it does not come back. And this is the silent destruction I am talking about. There is no pain. There is no obvious symptom. You feel completely normal. You take your pill every morning, and your kidneys are slowly, quietly losing their ability to function. Now let me tell you what to watch for, because even though this damage is often silent, there are clues, and most people miss them because they assume these symptoms are just part of getting older. The first warning sign is swollen ankles and feet, especially in the evening. Your kidneys regulate fluid balance. When they are struggling, fluid builds up. Many seniors notice their ankles puffing up at the end of the day and assume it is from standing too long. Sometimes that is true, but chronic ankle swelling can be a kidney signal. The second warning sign is foamy or bubbly urine. This one surprises people. When protein starts leaking into your urine, which happens when your kidneys' filters are damaged, the urine develops a foam or a persistent bubble. If you notice this, please take it seriously. This is one of the earliest signs of kidney damage. The third warning sign is fatigue and brain fog. Your kidneys produce a hormone called erythropoietin, which signals your bone marrow to produce red blood cells. When kidney function declines, this hormone drops, red blood cell production falls, and you develop what we call anemia of chronic kidney disease. The result, you feel exhausted, mentally foggy, like you just cannot get going no matter how much sleep you get. The fourth warning sign is changes in urination. More frequent urination at night, what doctors call nocturia, or producing much less urine than normal. Both can be signs that the kidneys are under stress. The fifth warning sign is a persistent lower back ache. Not the normal muscle back pain from bending or lifting, but a dull, deep ache in the kidney area, below the ribs on either side. Persistent and unexplained. The sixth warning sign is loss of appetite and a metallic taste in the mouth. When waste products build up in the blood because the kidneys cannot clear them, a condition called uremia, it creates a chemical taste in the mouth and kills appetite. This is a more advanced sign, but it is one that seniors often dismiss as just not being hungry lately. If you have any two or more of these signs and you are on a blood pressure medication, please ask your doctor to run a simple blood test called a metabolic panel and check your creatinine levels and your eGFR. That stands for estimated glomerular filtration rate. This tells you exactly how well your kidneys are functioning right now. It is a simple test, it is inexpensive, and it could save your life. Now, not everyone on blood pressure medication will develop kidney problems. I want to be fair about that. But certain people are at significantly higher risk, and I want you to know if you fall into one of these groups. The first group is people over the age of 60. We have already discussed why. Reduced kidney reserve means less ability to compensate. The second group is people with diabetes. High blood sugar damages the small blood vessels inside the kidneys independently of medication. Add a blood pressure pill that further reduces kidney pressure, and the risk multiplies significantly. The third group is people who are on multiple blood pressure medications at the same time. It is very common for seniors to be on 2 or even 3 medications, an ACE inhibitor plus a diuretic, for example. Diuretics like hydrochlorothiazide reduce the fluid in your body, which also reduces blood flow to the kidneys. Combined with an ACE inhibitor, the effect on kidney pressure can be severe. The fourth group is people who take regular NSAIDs. These are over-the-counter pain relievers, ibuprofen, naproxen, drugs like Advil and Aleve. Many seniors take these regularly for arthritis pain. NSAIDs also reduce blood flow to the kidneys. When combined with an ACE inhibitor, the combination is particularly dangerous. There is actually a medical term for it, the triple whammy, ACE inhibitor plus diuretic plus NSAID. This combination alone can cause acute kidney injury in older adults. The fifth group is people who are chronically dehydrated. Many seniors do not drink enough water. As we age, our sense of thirst decreases. Dehydration concentrates the blood and reduces kidney blood flow. When you add a blood pressure medication on top of dehydration, the kidneys can go into acute stress very quickly. If you fit into any of these categories, please have a conversation with your physician. Tell them you want your kidney function tested. You have every right to ask for that. Now, here is where I want to give you something practical, something you can start doing today that research shows can genuinely support kidney health and help protect your kidneys, even if you are on medication. The first natural strategy is hydration. This is the simplest and most underutilized kidney protection tool we have. Your kidneys need water to filter properly. I recommend a minimum of 6 to 8 glasses of plain water per day for seniors, and more if you are in a hot climate or physically active. Not juice, not coffee, water. Dehydration is one of the fastest ways to stress kidneys that are already under pressure from medication. Make it a habit to drink a full glass of water in the morning before your medication. It makes a measurable difference. The second natural strategy is to reduce sodium dramatically. Excess sodium forces your body to retain fluid, raises blood pressure, and increases the work your kidneys have to do. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for people with high blood pressure. That is less than 3/4 of a teaspoon of salt. Read your labels. Processed foods, canned soups, deli meats, and packaged snacks are loaded with hidden sodium. Eliminating processed food alone can lower blood pressure by 5 to 10 points in some patients. The third natural strategy is to eat kidney protective foods every single day. There are certain foods that research shows specifically support kidney filtration and reduce inflammation in kidney tissue. Berries, blueberries, strawberries, raspberries. These are rich in antioxidants called anthocyanins that protect the delicate blood vessels inside the glomerulus from oxidative damage. Olive oil, specifically extra virgin olive oil. The oleocanthal in olive oil acts as a natural anti-inflammatory. Studies have shown that regular olive oil consumption is associated with significantly lower rates of chronic kidney disease. Garlic. Raw or lightly cooked garlic contains allicin, which has been shown to reduce kidney inflammation and protect nephron tissue. I recommend 1 to 2 raw cloves per day or adding it generously to cooked meals. Red bell peppers, extremely low in potassium compared to other vegetables, and very high in vitamin C, B6, and folic acid, all of which support kidney cell repair. Cauliflower, rich in indoles and fiber that help your body neutralize toxins to other pathways when kidney function is reduced. And finally, water-rich fruits like watermelon and cucumber. They support kidney flushing gently and naturally. The fourth natural strategy is magnesium. Studies show that magnesium deficiency is extremely common in seniors, and it is associated with higher blood pressure and poor kidney function. Foods rich in magnesium include pumpkin seeds, dark leafy greens, almonds, and avocado. Some patients benefit from a magnesium glycinate supplement, typically 200 to 400 milligrams at night. But please check with your doctor first, especially if you have kidney disease, because magnesium is processed by the kidneys and supplementation must be done carefully. The fifth natural strategy is to reduce your protein load, but do not eliminate protein. The kidneys process the waste products of protein metabolism. Too much protein, especially from red meat and processed meats, increases the filtration burden on already stressed kidneys. I recommend moderate protein intake for seniors on blood pressure medication and prioritizing plant proteins like legumes, lentils, and tofu over red meat. The sixth natural strategy is to move your body every single day. Even a 20-minute walk daily improves blood circulation to the kidneys, helps regulate blood pressure naturally, reduces insulin resistance, and supports kidney function. You do not need a gym. You do not need equipment. You need your shoes and 20 minutes. Now I want to help you walk into your next doctor's appointment prepared. Because in my experience, the patients who advocate for themselves, who come in with specific questions, get better care. Here are the exact questions I want you to ask your doctor. Ask them, can you please test my eGFR and creatinine levels? I want to know my current kidney function. Ask them, is the blood pressure medication I am currently on safe for my kidneys given my age? Ask them, are there any alternative medications that may have a lower impact on kidney function for someone my age? Ask them, should I be concerned about taking ibuprofen or naproxen with my blood pressure medication? And ask them, what specific kidney symptoms should I watch for and report to you immediately? Write these down. Bring this list with you. A good doctor will welcome these questions. And if your doctor dismisses your concerns without answering them, that itself tells you something important. You are not a passive recipient of healthcare. You are a partner in it. And the more informed you are, the better that partnership works. I want to briefly address the question I know many of you are thinking right now. If this medication is hurting my kidneys, can I switch to something else? The answer is sometimes yes. There are blood pressure medication classes that have a different mechanism and a lower direct impact on kidney filtration pressure. Beta blockers, for example, medications like metoprolol or atenolol, work by slowing the heart rate rather than directly dilating blood vessels via the angiotensin pathway. They carry a different risk profile. Calcium channel blockers have their own considerations, but may be better tolerated in some patients. There is also growing evidence for lifestyle-based blood pressure control. Several large studies have shown that dietary changes, specifically the DASH diet combined with sodium restriction and regular exercise, can lower systolic blood pressure by 10 to 15 points without any medication at all. For some patients, that is enough to reduce or eliminate the need for the medication entirely. I want to be very honest with you. For some patients, particularly those with very high blood pressure or those who have already had a heart attack or stroke, the cardiovascular benefit of these medications outweighs the kidney risk. The medication may genuinely be keeping them alive. But for others, particularly those with borderline high blood pressure, who are on medication almost out of habit or routine. A lifestyle-first approach, supervised by a physician, may allow them to reduce or come off the medication entirely. This is a conversation, not a decision you make alone, but it is a conversation worth having. Let me bring this all together for you. If you are over 60 and you are on a blood pressure medication, particularly an ACE inhibitor or ARB, like Lisinopril, Losartan, or Ramipril, your kidneys deserve your attention. Not panic, not fear. Attention. The damage this medication can cause is silent and slow. It does not hurt. It does not announce itself, but it is measurable and it is preventable if you catch it early. So here's what I'm asking you to do this week. Number 1, watch for the warning signs I described today. Swollen ankles, foamy urine, fatigue, changes in urination, metallic taste. Take notes. Number 2, ask your doctor to run a metabolic panel and check your eGFR and creatinine. If you have not had this done in the last 6 months, you need it done now. Number 3, start drinking more water today, right now. It is the simplest thing you can do for your kidneys, and it costs nothing. Number 4, add at least 1 kidney protective food to your daily diet. Berries, olive oil, garlic. Start there. Number 5, have the conversation with your doctor. Use the questions I gave you. Be your own advocate. Your kidneys have been working for you every single minute of every single day since before you were born. They have never once asked for anything in return. It is time to take care of them. I am Dr. Thomas Reed. Thank you for trusting me with your health today. If this video helped you, please share it with someone you love who is on blood pressure medication. They deserve to know this too. And if you have questions, leave them in the comments below. I read them, and I will do my best to answer. Take care of yourself. I will see you in the next video.